enabling cardiac technologies, whereby bypass surgery joining can be done literally in 6 seconds with push of a button.
With over more than 50 installations, SSI Mantra is already spreading its wings, and over 1400 complex surgical procedures have already been performed using the SSI Mantra system across the country. Doctors worldwide appreciate the system's versatility, ease of use, and innovation.
And our system is very different than the existing technologies. It has more advanced, better features, more specialties, including cardiac surgery, that no other system has capability to do full spectrum cardiac surgery.
I feel that it is going to bring a revolution in the robotic healthcare system, where robotics is going to get into the healthcare system, and definitely it is going to get robotic surgery to the doorsteps of every individual who is living in rural India as well.
SS Innovation's quest for excellence doesn't stop with Mantra. SSI Maya's virtual reality and SSI Chitrasa's DICOM viewer promise to shape the future of robotic surgery.
So we have a Maya division. It is exploding literally at a very, very fast pace. So we can take these images and convert them into 3D models the surgeons can manipulate, and it makes the procedure safer and more efficient.
So a lot of innovations and a lot of out-of-the-box thinking has been put into it, which I think will be useful for surgeons once they start using it. And then there is a good future there, because a lot of artificial intelligence is being added. We've got more screens. We can use more than just 4 robotic arms.
And also it is prepared right from the beginning for teleproctoring. And that means I can sit in Delhi and guide surgeons wherever by bringing their 3D signals over high-speed connectivity and literally guide others.
Being a young engineer and having completed my studies in mechatronics field, I take complete pride to work on this ambitious project, which is very much cost effective.
I'm very proud of our entire team that has worked very hard to achieve this innovation as SSI Mantra surgical robotic system. We're always looking for opportunities to incorporate newer ideas and enabling technologies that will help the surgical team. The clinical guidance from Dr. Sudhi Srivastava and other surgeons have been instrumental in our rapid success.
And I think the opportunity for a company like SSI is quite profound. The opportunity is not just about making robotics affordable. It is also about expanding the capability and the understanding of the technology and the opportunity to develop sort of the next generation of surgical technique with the benefit of robotic technology.
He is the undisputed pioneer. He's blessed.
The SSI Mantra story is about changing lives, fulfilling dreams, and building a healthier future for all.
SS Innovations performed the first ever telesurgery using the SSI Mantra surgical robotic system on an animal in India. The surgery was carried out between the SS Innovations headquarters and the World Laparoscopy Hospital at a distance of 5 kilometers in Gurugram, Haryana, using the seamless connectivity of Airtel network without any latency issues. The surgical feat involved 4 procedures: radical nephrectomy, cystectomy, cholecystectomy, and prostatectomy. The surgeries were performed by a team of distinguished surgeons led by Dr. Sudhi Srivastava, MD, Chairman SS Innovations. The The second telesurgery animal trial, a consortium of 6 complex procedures was performed, including robotic CABG, hysterectomy, cholecystectomy, liver resection, gastrojejunostomy, cystectomy. Each one of these operations showcased the pinnacle of surgical robotic innovation. The participating surgeons reported 0 technical glitches or latency issues and expressed that it was very similar to performing surgery on a patient in a traditional operating theater. Their confidence in doing telesurgery on humans with the SSI Mantra surgical robotic system in the near future stands as a testament to the indelible leap made in advancing medical technology.
While we are about to start, can
The
I please
SSI
request
Mantra
all the
surgical
backbenchers to
robotic
come in the
system
front?
has created history by facilitating the first ever telesurgery human trial, spanning a distance of 5 kilometers.
Can I
between
please
the
request all of
SS
you to please
Innovations
move forward?
headquarters and the World Laparoscopy Hospital in Gurugram, Haryana, with the seamless connectivity of Airtel network. The cutting-edge Mantra surgical robotic system has shattered geographical barriers and rewritten the boundaries of possibility. The cholecystectomy procedure was performed with imperceptible latency issues by Dr. R.K. Mishra, Director and Chief Surgeon, World Laparoscopy Hospital, under the expert guidance of Dr. Sudhir Srivastava, visionary founder, chairman, and CEO, SS Innovations. This stands as a testament not only to national pride, but also as a significant stride forward in the global healthcare landscape, paving the way for unparalleled accessibility and medical excellence, promising a healthier future for all. With this momentous telesurgery.
Hello and a very good morning to all the distinguished guests and our esteemed media friends. My name is Shruti Mishra, and it's my honor to welcome you today as we make a couple of biggest and revolutionary announcements for the Indian health tech sector. Before we kickstart, to make an auspicious beginning, we now request our guests to come for lamp lighting. May I please request Dr. Sudhir Srivastava, Dr. Vishwa Srivastava, Dr. Sudhir Raval, Dr. Annadurai, Dr. Somashekar, and Dr. Rajput to come forward for the lamp lighting.
वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय भालचन्द्राय श्रीगणेशाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय भालचन्द्राय श्रीगणेशाय धीमहि. गानचतुराय गानप्राणाय गानान्तरात्मने गानोत्सुकाय गानमत्ताय गानोत्सुकमनसे गुरुपूजिताय गुरुदेवाय.
I would now request all of you to please come on the stage. Can we please remove the lamp from the stage? I would now request everyone to please stand for national anthem.
Jana
Jai Hind. Thank you. As an Indian, I feel an immense pride today as Sudhir Srivastava Innovations, India's first multi-speciality and only surgical robotics company, introduces us to the technologically superior and most advanced surgical robot developed entirely in India. We are here to realize a dream of Atmanirbhar Bharat, a dream of self-sufficient India. Today, we are also going to make a groundbreaking announcement in the Indian telesurgery space, which is going to provide a breakthrough to decentralize and democratize medical excellence in India and set an example for the world. Without taking much of your time, I would like to invite Dr. Vishwa Srivastava, President and COO, SS Innovations, for a welcome address.
Very good morning to all. Firstly, on behalf of SS Innovations International, I would like to welcome you to the launch of the Mantra 3 system. If you know anything about SS Innovations, you know that we work very quickly because we have very strong inspiration that drives us forward. When we had our first global conference last January, the decision was made that we must do something different. We must evolve to continue the evolution of science and making surgical robotics affordable and accessible to all, not only in India, but around the world. So firstly, I'd like to thank everyone gathered here today in the audience and those viewing online. I would like to thank the distinguished doctors who have helped us reach this stage, without whom we would not be here. I would also like to thank all those in the country who have shared their pride with us in what we have been able to achieve, all having emerged from humble beginnings. In welcoming our honorable guests, I would like to thank Dr. Giridhar Gyani, who's actually en route. He's the Director General of the Association of Healthcare Providers, and he's widely known as the founder of healthcare quality in India. He played a pivotal role in the formation of the National Accreditation Board for hospitals and healthcare providers, which he ultimately helped lead, providing patient safety throughout the country. Dr. Mailswamy Anadurai, he's former director of the Indian Space Research Organization, and he continues to be a tremendous inspiration to our entire engineering team at SS Innovations. And Dr. Sudhir Rawal is the medical director of the Rajiv Gandhi Cancer Institute and Research Center. And without his support, none of this would have been possible at all. He's been in our corner since day one of our Mantra 1 clinical trials, and he's taken us to where we are today, sharing our vision of delivering the best healthcare to all patients in India. And then we have Professor Dr. Somashekar SP, Chairman of the Medical Advisory Board at Aster DM Healthcare. Dr. Somashekar is perhaps one of the most dynamic surgeons I've ever met in my life. His passion for teaching, training, and surgical excellence is an inspiration to all doctors around the globe. Also en route, Dr. Nitin Rajput. So I'm very grateful to have met Dr. Nitin. So in addition to being one of the most highly skilled and talented young heart surgeons of the country, he quickly adopted our Mantra system to perform very complex cardiac surgery, and till date, he's performed the highest number of robotic cardiac procedures in the country and on the Mantra system. Dr. Devi Shetty, who will be joining us virtually. As you know, he's the chairman of Narayana Health. His leadership and compassion towards providing equal access to healthcare should serve as an inspiration for us all. Also, virtually, Dr. Naresh Trehan, and having left the US similar to Dr. Srivastav in the 1980s, he returned to India, and he became a pioneer in the ways that we approach heart surgery. He trained countless surgeons throughout the country. He's a respected leader in the medical community, and he's also known for creating Vedanta. It was a paradigm shift in the new standard of how healthcare institutions should be in the country. And lastly, Dr. Frederick Mall. He's the founder of Intuitive Surgical and the father of surgical robotics. He's been a pivotal visionary and leader in the field of medical robotics, and he started many other robotic companies even after his original Da Vinci system. He's been a strong supporter of SS Innovations and our global vision, which he shares, bringing both his experience and enthusiasm to the team at SS Innovations. And you'll hear more from him later today. To all those in the audience, members of the press, friends, and family, I'm very happy to welcome you to our SS Innovations Mantra 3 launch. and to report the successful completion of the first ever telesurgery done on a human in India. We have a very exciting lineup of speakers who will help shed light on just why what is being presented today is very important, not only for the country, but for the entire world. Thank you and welcome.
Thank you so much, Dr. Vishwa, and I'm sure everyone sitting here is now excited to know so much more about SSI Mantra 3 and what makes it so superior and technologically so advanced. I would now like to invite the man himself, Dr. Sudhir Srivastava, founder chairman, SS Innovations, a pioneer in robotic cardiac surgery, and who is also recognized as the father of robotic surgery in India. Dr. Srivastava's passion and love for his motherland pulled him back to his roots, so that he can contribute in revolutionizing the surgical robotics for India and the world. Dr. Srivastava, may I please request you to address the gathering now.
Good morning, and thank you, Shruti and Vishwa, for your kind introduction of so many people. I want to extend my also personal welcome to you all. There are a lot of very familiar faces, colleagues, friends, and media, many of you I've talked to, and our team and the family from home. So great to have you all here. And so I'm going to skip some of the details that I have discussed in the past regarding how we got there, but rather than go straight into, I think, what we are here for today. And there's a little disclaimer. We are a public company, and I'm expected to show that. And so right in the beginning, let's look at what is the scene in India. So back in 2002, I did the first ever robotic case in the country at Escort Heart Institute. You see Dr. Trehan there, and then President Abdul Kalamji, who was in the room during the inauguration, and he watched the robotic surgery. And being a scientist, he was quite intrigued that where and how we could do some of these procedures truly in a teleoperation situation. So when we look at the global robotic scene, and what really prompted me to start looking as to different ways to advance this robotic, wonderful technique and technology that can help patients really reduce their morbidity and get back to their functional life status. So today we have roughly over 8,000 robotic systems, and most of the penetration, almost 90%, remains in developed economies, United States, Europe, and Japan. And that means almost 7 billion people globally do not have easy access. And the biggest reason is cost and a steep learning curve that has been associated with robotics. And it's a shame that in India, when we talk of the 70,000 hospitals with a population of 1.4 billion, we do have only roughly around 230 or so robotic systems. And that means there is a much urgent need to change this. There's no reason that the patients in many countries, including India, should not have access, and that is really what has been the driving force. And also, when you look at robotic systems in relation to the global comparison, we have 0.07 per million in the country. And it is very unattractive to a lot of hospitals because of the high cost. And also training programs are not really well organized. And there are some die-hard surgeons who are really trying to teach a lot of people. But it's a very small number considering the need that is in the country. So we've got to change. So with this, we created SS Innovations with the idea to come up with a technologically advanced system that hopefully will surpass many other robotic technologies, and finally be affordable to benefit most patients in the world. You know, I say that technology, if expensive, it is not going to benefit most. And it is only through technology that we can actually change the direction of healthcare for so many people. And our mission is to really make it gold standard and affordable for all. A very quick catch-up on our journey. It started in 21 with our Mantra 2 development, and we did our first trial with Dr. Rawal, and he's been literally a champion for the evolution of SS Innovations and the Mantra system. We did the trial, and we did have also certification in India, ISO 13485, which is a standard required internationally for medical devices, and our local Indian CDSCO regulatory approval. And our first commercial launch was in July. Again, Dr. Rawal likes to get the things first, and so it was his hospital that the system was launched. And since then, I think roughly over 20 systems were launched in different stages in 23. And this year, we have moved very rapidly. Within the first 5 months or so, we have sold almost 28 systems. And in May, we did our first animal telesurgery trial sitting in our office. And there were quite a few surgeons, and some of them are here in the group here today. And we were able to operate in an animal model 5 kilometers away at World Laparoscopy Hospital. So that was the first trial that we did. We did 2 pig models that time, and very successfully. One of the biggest issues with telesurgery is always a concern, is there going to be a delay in transmission? And to our surprise, there was almost imperceptible delay. In fact, the surgeons who were there in the room that time, they made a comment that it's just like you're operating in the same room. And since then, we did, in fact, our first human live telesurgery just about a week ago. The gallbladder was taken out. And so now we are on to Mantra 3. And as Visha pointed out, that literally in 5 months, the next generation, and in my opinion, as a robotic surgeon, not as a SS innovation leader, is the best robotic system today globally with all these very advanced features that currently nobody has, and also tremendous enabling technologies that we have developed, and also features that currently, again, no other company has. Also, multi-specialty spectrum, including heart surgery. So our goal is to do clinical trial, again, with Dr. Rawal starting out with the Mantra 3 system, and do a commercial launch at some point next month. US FDA, European CE approval, they're all in the process, and we do have today regulatory approvals in quite a few countries. Our facility in Gurgaon, I must say we are very proud of what has been achieved. And literally, it's an absolute teamwork. And someone asked me, what is your greatest asset? And I said, our team. And very proud, young engineers, and they're so dedicated. It's phenomenal, how fast they move. This just shows various regulatory approvals that are ongoing. Now, I'm going to get into the technology. So many of you are familiar with our Mantra 2 system, and it is functional. So there is no issue at all with the Mantra 2 system. Goal was to get to the next level, because I think science must continue to evolve. I think it doesn't matter what area of science or technology we look at, it is constantly changing. And we must remain very focused on improving on things, otherwise status quo is no good. So now we have Mantra 3, and this system is quite different, very advanced than Mantra 2 today. So very slim, sleeker robotic arms that are modular, and the best part is it allows using 3, 4, or 5 arms, and as you can see on the stage here, the 5-arm system that is docked into this mannequin. And basically, there is no collision because of the slim design, and one can use up to 5 arms to do some of these complex operation, or use enabling technologies that otherwise you have to constantly switch. And it's a smaller footprint, Surgeon Command Center. I used to joke with my team, we need to get rid of this large Surgeon Command Center, and there was a lot of debate. And so what we have done, as you see, is a chair now compared to the previous version. And I have asked our team to make one for my bedroom, and I can operate from sitting there. And it will be possible at some point that we can do. So it is very actually slim design and very comfortable ergonomically. The glasses are augmented reality and mixed reality glasses with beautiful resolution. And we get rid of a large monitor. Of course, it will be available if somebody wants it. And the foot pedals are on a tray that goes inside. All electronics and computers are literally inside of this chair. And so it is currently the most advanced Surgeon Command Center, using also magnetic sensor devices, so you don't have to hold some of these sometimes cumbersome controls. And you have a free hand and a tremendous reach. And also built-in 2D monitor for all kinds of things that are required in relation to the controls or pulling up the images. Or our Maya division has created whereby we can literally take a CT or an MRI and convert into a 3D model. It has a built-in teleproctoring capabilities. The vision cart, again, is slimmer. A beautiful 4K 32-inch 3D monitor for the entire surgical team. And built-in recording playback capabilities, all integrated into this slim design. And also built-in teleproctoring and telesurgery capabilities are all there today. We are partnered currently with Olympus. It's an articulating camera, and it has got wonderful resolution. Over 40 plus all different types of instruments for multi-specialty. And on top of that, we have focused also on reviving the robotic cardiac surgery. And unfortunately, although the original robot was built for heart, but the saying goes it started at heart and landed on prostate. And with heart surgery, patients end up having their sternums split. And in my own personal experience, we used to do surgery through literally tiny fingertips holes, and the patients, 20% went home next day. So it's a wonderful way of doing complex cardiac operations today. And the goal was to really revive, because unfortunately, because of the lack of support of enabling technologies, people gave up because of the nature of the specialty. But we have developed some enabling technologies which will absolutely revolutionize how bypass surgery is done in future. With push of a button, 2 arteries get joined in 6 seconds literally. Our Maya division is absolutely phenomenal, and we have a team of very bright people that are working on augmented, mixed reality, virtual reality, and XR. And also we have developed teleproctoring. In fact, I have done 2 teleproctoring cases, one in Bangalore, sitting in fact in a hotel during our last conference, and another from our office to Ahmedabad. So this will be a huge actually advance in terms of launching programs, helping surgeons don't have to travel. And I think it will be more efficient and predictable. And sometimes it is not easy to just keep going wherever. This is what we did, 2 teleproctoring cases, literally sitting in my office. And I could eat lunch while talking to them. And one was in Ahmedabad, almost 1,000 kilometers. And in Bangalore, which is over 2,000 kilometers, both were cardiac cases. Now, in terms of where we are today, we have, at this point, around 50 systems that we have sold. Over 35 absolutely flawless live demonstration have been done in various conferences, national conferences that have occurred. More than roughly 1,400 all different types of surgeries have been done. Almost 70 different types of procedures have been done from mouth down to pelvis and everything in between. And 300 plus surgeons now have been trained across the country. and their staff also. So when you look at what has been done, majority of the patients ultimately do fall in urology because of just the nature of presentation of pathology, but I think general surgery has been very rapidly advancing. We have done 103 cardiac cases, and I think Dr. Vishwa pointed out, we are grateful to Dr. Nitin Rajput, who has done most number of cardiac cases at Narayan Hrudayalaya. Very proud to share, we have zero mortality, no device-related injury caused due to the device. There is no device-related complication. And as you can see, majority of the procedures today are multi-specialty. And we are gradually launching cardiac programs. And currently, we have done over 100 cardiac surgeries with our system. Where are we heading to future? We have single-arm applications for tele-diagnosis and teletherapy. And this is really, the goal has always been decentralized and democratize access and excellence. And I think we are going to achieve that. And final thing would be, of course, telesurgery. And this is how we have performed. We have partnered with Airtel. And the first one that was done at World Laparoscopy Hospital, it was done through RF transmission. And even then, hardly any latency. And this procedure was gallbladder, just over an hour. There were no transmission issues, system issues, no complication, no perceptible latency. And this is a little video of the surgery. And as you can see, the system is at World Laparoscopy Hospital. Dr. Mishra is sitting in our office in Gurgaon, 5 kilometers away. And I must say it was really remarkable because the whole telesurgery concept existed back in the 80s when NASA and Defense Department of United States funded the research to be able to operate in long distance in space or in battlefield. Now, with the technology capabilities as well as available high-speed connectivity, it's all real. And this is really what's going to change as we move forward in bringing the care to people instead of patients having to travel. And this is actually a universal problem of access. And you can see the gallbladder is being taken out. So with that, I will stop here. And thank you all very much, and Jai Hind. Yes, I know. Let me just get down here.
Thank you so much, Dr. Srivastava. And now Dr. Vishwa is going to give us a live demo of the revolutionary SSI Mantra 3 that we all heard about just now.
So I was asked to do this live demo, and now after hearing this talk from our chairman and also my father, Dr. Sudhir Srivastava, going back to January and, he being the catalyst, and inspiration for us, always pushing the envelope and continuously evolving, and all my engineers in the back room are looking at me with a lot of disdain and right now for, working countless nights. And the one thing I will say is that I'm so proud of our engineering team. They're really a true testament, to the brilliance that exists in this country. And I think all of you should be very proud of the work that they've been able to do here. No one ever thought it could be done in India, and they've proven everyone wrong. So I'd like for you to give them, please, a round of applause. But, I was asked to do this demo. I sit on the system day in and day out, and but I think it would be more appropriate, and I would be honored if my father, Dr. Sudhir, would do the honors of, christening the system.
Is my microphone on? So as you can see, this is the entire surgeon command center, which one day even might get smaller, lighter, and be available in Dr. Raval's or Dr. Somashekar's office to be able to operate from wherever. And I think the whole idea of trying to create, so first of all, as you saw from the presentation, the robotic arms have become much smaller and slimmer. And the reason for that, it absolutely avoids collision in relation to some small patient body habitus. And we can use up to 5 arms. So currently, at least to my knowledge, the 5 arm this way have not been used in the world. Our goal is to, in fact, potentially give 2 surgeon consoles and 5 arms, whereby 3 are controlled by the surgeon, primary surgeon, and 2 by the assistant surgeon. So the entire surgery can be done literally, completely robotically, including assisting. Of course, you need the nurses to exchange the instruments. Much smaller vision card, and this is it as far as the command center is concerned. So what I am holding in my hand are these little, what we call the hand controls, and these are based on sensors, and there's a magnetic field. So any motion gets picked up by the changes in the magnetic field, which gets digitized and then gets transferred into the computer and controls all this. And it's probably less than 100 grams in the hand. So the fatigue factor is not there. You have absolute freedom of motion. Of course, one has to be careful. Don't sneeze and bring your hand up to the nose. So there are certain, built-in guidance, and also we have sensors. So if it's not in your hand, it will stop working. Also, there's a magnetic field that we have created a virtual boundary. So if your hand does go, you want to scratch your head, system won't respond. So we do have built-in complete features here. And on the right side, there is a 2D monitor for variety of images one can bring, and so on. And as I mentioned, very proud of our team to have created this thing in 5 months. Many other companies take years. So kudos to you guys. All right, so I'm going to wear these glasses. So we have these 3D glasses, beautiful resolution. So, previously we used to have monitors. So I can literally see here, and it gives me a very nice magnified view of roughly 42-inch of the screen size. And I have absolutely the same depth perception that I will otherwise have with the glasses. And so here, give me the controls, please. And of course, surgeon seated, they can do all this thing. But just for sake of efficiency, our team is activating the hand controls. And let me know when it's ready. And within the foot tray, there are various pedals, and there is what you call a master clutch. So when I press that, I can reposition my hands, although we do have a finger clutch also, which surgeons can reposition individually their arms. And then there is a camera pedal. So by pressing the camera pedal, when I move my hands, the camera will move. You can zoom in and out, move it sideways. Then there are very typical functional pedals which control various cautery instruments. And also we have instituted roll, and by pressing the camera pedal and pressing either the right or the left yellow pedal, we can roll the camera. And also there are 2 toggle pedals. And what that means is that, as you can see here, there is a camera in between, and there are 2 instrument arms on each side. So I can, since I have only 2 hands, I can control two things at a time. So we use this term toggle between the arms. So when I press the toggle pedal, I can switch between two left arms or two right arms. And currently, to my knowledge, no surgeon console has these built-in controls for up to 5 arms within the same command center. There's also an infrared sensor. So for any reason, if I'm not holding the controls, or by accident somebody kind of drops it or does, immediately the system stops within like 4 milliseconds, which is nothing really in terms of the time factor. So all built-in safety features are incorporated here. Ready? Okay. So now they've given me the controls, and I'm able to move my arms. And I'll just show a little motion with the camera. So I can zoom in and out to move it sideways, all of this thing. And basically, it's very precise. With the 3D vision, I can move these things around. So basically, the goal was really to show this functionality of the system. And I can toggle between the arms. So now I have the control of the fourth arm. I just, with the foot pedal, I control that thing. And I can go back again to my thing. So I think that is enough for this thing. So for the sake of time, we will continue with the presentations. And just wanted to just have a little demonstration that we could do this whole thing sitting here. Thank you very much.
Thank you so much, sir, and the ease with which you do all of this is so fascinating for us. We are now joined by the global father of robotic surgery, live from California, Dr. Frederick Moll, who is the founder of Intuitive Surgical. After leaving Intuitive Surgical, Dr. Moll created a series of surgical robotic companies and is an investor in SS Innovations. It's our pleasure to have you with us, Dr. Moll, as we witness this day today. And we are super excited for the announcement that's coming our way from you now.
Well, good morning, and hello from California. I'm excited to be with you, and I guess I'd want to start out by congratulating Dr. Srivastava and the entire SSI team on the completion of the new Mantra 3 and the system development that took apparently less than 5 months, which is quite an accomplishment. In addition, I think congratulations are in order for the first completion of the first human telesurgery case in India, which is, I think, quite a waypoint in the development of the overall accessibility of robotic technology in the region. I've been involved in robotics since 1995 when I founded Intuitive Surgical. And certainly the field has grown dramatically since that time. So my first introduction to SSI was in 2022, and I have been peripherally involved in helping SSI from time to time, but up to this point. But I'm now excited to get more involved, and my intent is to join the board of SSI and participate more directly in the company as vice chairman. The Mantra 3 represents an exciting step towards the future of robotics, as it provides a number of system innovations, some of which you've just heard about, but they include novel robotic arm design, advanced visualization, and control architecture, as well as I mentioned, the dawn of telesurgical capability. Mantra 3 is, I think, especially powerful as it extends in using the capabilities of telesurgery. It extends the access of robotic surgery to more people and in a more efficient manner than previously possible. Robotic expertise can be transmitted over long distances so that more patients can benefit from the technology, and as well as the individual expertise of specific clinicians that are experts in their field. Perhaps the most powerful aspect of the Mantra 3, though, is its affordability. India and many countries could utilize tens of thousands, quite frankly, of surgical robots in the future. But affordability has been a significant barrier to date. I believe that Mantra's pricing can catalyze dramatic growth and adoption of robotic technique across the globe. Finally, the focus that SSI has placed on cardiac surgery will really be unique in the current robotics market and will further distinguish the company's market presence going forward. So I feel very fortunate to be a small part of what I think is an enormous change in the global access to advanced, state-of-the-art robotic technique. And I think you will see over the coming quarters that the momentum in the use of this technology will grow dramatically. And as I say, I'm excited to be a small contributor to, I think, what will be a very large movement in the robotics market, and not just in India, although there's plenty of market opportunity obviously in India itself, but I think it will have a global impact over the years, and couldn't be more excited about the future and the future innovation that Dr. Srivastava, Vishwa, and the team, who are an extraordinary group of engineers and innovators, can bring to the market. And so thank you so much for your time, and I'll stop here.
Such an honor to have you in this journey of SS Innovation, sir. Thank you so much for joining us from California. I know it's quite late there. Telesurgery till date had been a distant dream in the country. While small procedures have been done, performing a proper surgery through a distance had never been accomplished. Dr. Sudhir Srivastava has always been emphasizing that advanced healthcare is not a privilege for limited few, but a right of all. As a major step towards decentralizing excellence, a successful human telesurgery trial has been accomplished in our country through SSI Mantra. I would like to invite Dr. Mailaswamy Annadurai, ex-director ISRO Satellite Center, popularly known as Moon Man of India, who is also the board of director SSI, to share the vision of what it means for Bharat and many other countries around the world. Sir, can we please have you on the dais?
Dr. Sudhir Srivastava, Dr. Sudhir Raval, Dr. Somashekar, Dr. Vishwa, and the galaxy of surgeons and my beloved engineers, media friends. I also join along with others, first to congratulate Dr. Sudhir Vishwa and the entire SSI team for making this to happen, because this was more like a dream when we talked about in January conference. But the dream has come true today when we are talking about demonstrating Mantra 3. So this mantra, it definitely opens it up when you're talking about the future of the healthcare in India. You look at here, food security, I think reasonably we have done well. But coming to the health security point of view, definitely a lot more room is available. And in that room, mantra can play a reasonably good role. I think that's what we're talking about there. And that to happen, such a technologies is concerned, this is basically a convergence of medical science as well as engineering science. So this happened, and technology-wise, I think we are seeing its viability. And from Mantra 2 to Mantra 3 is concerned, I think that I think reasonably well it has happened. And now I understand that today already a Mantra 3 system is in US, and that will showcase global in this arena how it is going to behave. And Dr. Fred Mars is another way of trying to show the acceptability is coming among the surgeons' fraternity. When that is happening, beyond the technical viability, definitely when this has to move forward, you need the acceptability by the surgeons. Because I know I worked in 15 years back for the tele-education, EduSat was launched. I was a part of that mission. But unfortunately, though technically the mission was okay, unfortunately the acceptability among the teaching fraternity was not good that time. So that's why more or less that mission could not really fructify. But definitely during the COVID time, people understood. Now the tele-education is coming in a big way. But taking the lines from there, it calls for basically acceptability by the users. That means their education point of view, it is called for the professors and teaching fraternity. And that I think SSI has taken such a way, bringing the people around. Dr. Sudhir Raval and Dr. Somashekar, people like them, they are part and parcel of this Mantra 3. I know that. I think they are the part and parcel of this Mantra 3. So that gives an acceptability by the surgeon, and a good number of surgeons also among these galaxies, I'm able to see the acceptability by the surgeons is coming there. But again, beyond further to go, because especially Dr. Sudhir was telling about, it's possible penetration in the nation like India, where it is called for affordability. Affordability is definitely, it's really required. And Mantra 3 is basically, when you look at here, I used to tell time and again, an innovation is called for, and the innovation is affordable innovation. I think Mantra 3 is nothing but an affordable innovation, wherein the complicated motors, so the things have been in the place of that, the way in the new sensors have come, and the way in which the compact system has arrived at, definitely it envisages affordability is possible to provide that. Now, beyond that definitely is coming acceptability by the patients. They also, acceptability. I think today you look at here, I had the opportunity to go across very many these medical conferences and wherein the surgeons conferences, and I could see a good acceptability with respect to laparoscopy is concerned. And I think this is basically a graduation over that. So accordingly, I believe definitely when this graduation is taking place, acceptability of the patients also will come, especially place like India, wherein we talk about nearly, I was told by an estimate, nearly 3646, a number for 1 lakh patients, 1 lakh population, this many surgeries are happening there. In that, nearly 30% of surgery, I was told, it is happening between 30 to 50 years of age. This is the real productive age group of that, and they need to come forward at the earliest, and they need to get back to the work job also at the earliest. So there, I think this can play, laparoscopy has played a role, and here it can play a role. And there, again, now you're putting the thing here, super specialty hospitals are there, surgeons are there, specialized surgeons, but the patients is nook and corner of length and breadth of India, country like this. So the connectivity is called for, also is called for. So there comes the technical viability of today's technical viability. Already symbolically they showed. Symbolically showed few miles away, not more than 53 millisecond latency, the surgery could be done there. Similarly, telepracticing point of view, even from Delhi to Bangalore, it has happened there. So now this graduate further in the days to come, definitely in the name of same Airtel's another low Earth communication, and or else Elon Musk's Starlink, that is going to go not more than additional 40 to 50 millisecond, another thing, anywhere to anywhere in India. So that means within 100 millisecond, patients can be attended to from the super specialty hospital to that. So that means the connectivity of surgeon without he being moving to the place, and the patient without he being brought to this place, I think that's possible. That's what we are talking about here. That means this can be Dr. Somashekar can be sitting in his place, Dr. Sudhir Raval can be sitting in his place, without, till they can connect to a person somewhere in the nook corner of the primary health center of India. So that opens it up, a big possibilities, and that to happen. So these are all the possibilities. That to happen, definitely we need the support of the policymakers, because we know beyond the food security, healthcare point of view across India, I think both central and state governments are trying to do it their own way. And I feel this can fit into that package also. There is that possibility also existing there. So putting the things together, this to happen, because I know there was a time people used to ask about why India need to go to space. We have a lot of issues within India, why we have to go like that. But India cannot afford not to have the space like that you told. When that really is to happen, media played a reasonably good role. And that's why today, even Indian space program is one among the top when you're talking about that. Now we are going to take forward our Indian healthcare system also, one among the top in the world. Same space and our medical science can work together. So bringing the telesurgery in a real form, telediagnostic in real form, teleproctoring in real form. So that way happening, India can show the line what can be done to global arena also. That means what we talked today, January we talked about a possibility of this chair system. It's happened there. Today we are talking about a possibility, not a possibility, finite possibility of happening anywhere to anywhere in India, surgeon to patient connectivity, doing a real surgery is concerned. And that will show a way to the global arena for medical healthcare is concerned. That way, yes, India is rising. India is rising in the science and technology. India is rising in the medical science. And India is ready to roar for its own care. That's what we shown in the COVID. Not only it has seen to that its own population, it's definitely it helped for the other populace beyond its boundary. I think the day is not far. Today is the kickstart for that. Thank you very much for that.
Thank you so much, sir. This sounds so exciting and gives us a lot of confidence in Indian healthcare space. We will now be joined by Dr. Debi Shetty from Bangalore. Dr. Shetty, who is the founder and chairman of Narayana Healthcare, requires no introduction. He has performed more than 100,000 heart operations. In 2004, he was awarded the Padma Shri, followed by the Padma Bhushan in 2012, for his contribution to the field of affordable healthcare. Dr. Shetty will now share his thoughts on this Made in India robotic system and how it is capable of bringing India to the center stage of medical robotic technology. We believe Dr. Shetty is just wrapping up a surgery, and he'll be joining us anytime now.
Hello.
Hello, sir.
Yeah, can you see me?
Yes, we can see you and we can hear you too.
Okay. Can I start?
Absolutely, sir. We're waiting for you.
Yeah. Thank you so much. First of all, I would like to congratulate Sudhir for his tenacity and the audacity to build a Indian-made surgical robot today, which has demonstrated that it is going to have a massive impact on the surgical scenario of the country. It is truly a remarkable achievement, and I would like to wish him good luck. When I was going through surgical training program, every surgery was done by a big cut on the body, and that is how most surgeries were done. We never thought one day laparoscopes, cystoscopes, and all kinds of scopes will transform surgery and make it safer for the patient. Today, we are looking at another exciting development, which will possibly replace all the scopes. That is a robot. For us, this robot was a distant dream. We never thought that a time will come when an Indian company will venture into making the robot and our surgeons enjoy using it. And in the last, I think, more than a year, I have watched our young surgeons performing miraculous surgical procedures with remarkable ease using these robots. This is just the beginning. It is a matter of time. Most procedures, including the procedures on the heart, will be done through robot. I would like to congratulate all our young surgeons who truly inspire us with their skill, passion, and dedication. When I look at the younger generation, the way in which they perform the surgery, it is a heartening experience for me that our future generation will make all of us proud for all the hard work and dedication we have done to build the surgical specialty in India. Once again, I want to congratulate all the team members of Sudhir for a fantastic job he has done. And one day, we hope your robot will be part of the accessories of every operation theater in the world. Good luck and God bless.
Thank you so much, sir, for taking out time from your busy schedule. Thank you so much for joining us today.
Thank you.
May I please invite Mr. Girdhar Gyani, Director General, Association of Healthcare Providers, India, to join us on stage. Welcome, sir. Dr. Sudhir K. Rawal, Medical Director and Chief of Genito-Uro-Oncology Services, Rajiv Gandhi Cancer Institute and Research Center, who has been an early champion at every stage of SS Innovation's journey and has helped in the realization of this Make in India dream. From the first ever medical trial with SSI Mantra to reaching this stage, he has been a key contributor. Dr. Rawal has done the most number and most complex robotic surgical procedures with the Mantra system. It's my pleasure to invite him to talk about his experience and share his thoughts on the future of robotics in our country.
Morning, Dr. Sudhir Srivastav, Dr. Annadurai, Somshekhar, Vishwa, my friends Rajiv Sood, Bindal, and Chandramohan Vadni, and everyone. It's been a great journey with SSI since, I think, in between the pandemics when I saw the first facility in Visakhapatnam. And from there, we had Mantra 1 to our hospital in our theater, which we used. And Mantra 1 to Mantra 3, I think things will be completely different. We had a lot of ideas for doing surgeries since the robot came in the market, and the worst thing with the Intuitive was that monopoly, and they will not rather gel for anything. We give idea, they will not listen. We tell them that there are some problem in, it's not like America, but they never listened. And when we got the chance of having a Indian robot, that was one of the best thing which I could have had in my surgical career. You know, before Mantra, there were 2-3 companies where they came, but the ease of using Mantra, the affordability of Mantra 2 even, is phenomenal. And that is why it has already gone to 50 places in the country, and Nepal and Dubai also. Mantra 3, I always used to talk with Dr. Sudhir Srivastav that we should have someday 5 arms, which he has done in this. And the surgeon like me, I hardly use my assistant when I do the surgery. But a lot of surgeons, they depend their assistant. They ask him to pull one structure, and one structure they will pull with their one arm. I always thought of getting rid of at least reduce the intervention of the assistant, which hopefully we will be able to do with the Mantra 3, as this has 5 arms. And 5th arm we are going to hopefully use in putting the clips, using the energy devices, which they have, and that will be the game changer. The good thing they have done, this was not my idea, this was Dr. Sudhir Srivastav. Whenever we meet, especially when we were in Coimbatore, and that robot which was launched where Dr. Durai was there, Amarnath Durai was there, that time he told me that this disruptive idea of getting over the monitor of the surgeon console. He said, we'll put it in the goggles, and this is already being done with Apple ProVision and all, but the goggles which they are using, they're totally different. They have other advantage that you can look into the theater when you are operating. While you put the Apple ProVision, you can't see anything except the operation field. And I used to get get used to of having the theater when we use the open console of SSI Mantra in our theater, because you can see the robot if it is hitting with each other, or the assistant, how is he behaving. So many things you can watch while you are doing the surgery. And with the new console, and then they have those goggles, let us see how it goes. It looks very good in a workshop, and when it comes to theater, there always, with anything, there's some teething problem, but then the team is so good that they solve these problems very fast, and that's the all strength of this company. So with that, I'd like to congratulate Dr. Sudhir Srivastav, Vishwa, and whole team to coming with the new machine, and but this is not the end. The things they will go on. The innovation will go on, as now the other companies are also changing their approach. Though in last 20 years we had Da Vinci only, and they were changing something, some minor changes they will do, and they will increase the cost and come to the market. This is not going to happen, but for you the journey doesn't stop here. There are huge number of innovation can be done in this technology. Definitely my dream is to go with the single incision with the ease of using robot as we have now. With that, I'd like to congratulate you again, and thanks for having this machine.
Thank you so much, sir. Without you, accomplishing all of this was near impossible. It is now time to hear from Professor Dr. Somashekar SP, Chairman, Medical Advisory Board, Aster CM Healthcare, GCC and India Board of Director, SSI. Dr. Somashekar is deeply involved in teaching, training, proctoring, and helping launch various robotic programs. He's a frequent invited speaker at national and international conferences and is a visionary who will help change the healthcare standards in the country. Dr. Somashekar realized at a very early stage a need of a technology like SSI Mantra and the impact it can create in the Indian health tech space. Dr. Somashekar, may we please invite you to share your thoughts.
Thank you very much, Dr. Srivastava, dignitaries on the stage, my dear friends, surgeons, media people. I think you have two people in this room who have done more than 6,000 robotic surgery, highest in India. Sudhir has the record of number 1 and I hold the record of 2. So you have combined strength of more than about 15,000 robotic surgery done between 2 surgeons in India. And you know what astonished us? You take top 10 technology companies in the world. Take any of them, You take Google, you take Microsoft, any of them. Who heads them? Indian brain. The best brain in the world is India. The whole San Francisco looks to India. It was sad that the best brain in the world, the best technology, never made one of the best operative robot till Dr. Srivastava came. To refresh your memory, who gave wheel to world? India. Who gave 0 to? Otherwise, Romans were quoting 1, 2, 3, 4, 100 times you have to write. Who gave that concept of 0, which was a disruptive technology? We gave it. Who was the first surgeon in the world? Sushruta. Who made 100 instruments even before human beings knew there is something called heart, lung inside our body? He's the guy, Sushruta Samhita. So we gave one of the best technology in the world. We gave Vedas, we gave astrology, we gave astronomy. So it is natural that Indian origin brain, which went worldwide, came back to India, made one of the best robot for the world. I always say made in India, make in India, Indian solution for Indian problem, but for the world, because we Indians have shown the vision, light, direction to world, and then people take that road as if I have made and walked through. It's okay, we let people drive with their Ferrari on the road which we created. So this is exactly what is done. What is the very unique of SSI? Don't think it is economical, very cheap, affordable. No, that is collaterally came. The purpose was to build the world-class, state-of-art, best technological surgical robot, which is available for multi-quadrant, multi-surgeon to all the cities across the world. First tier, second tier, third tier, specialist, super specialist, head and neck, thorax, abdomen, everybody. More than that, whom do we make this robot? To the patient. What is the use of making a technology which elite 0.1% in the world, in 0.1% of the world can use it? It's a dead technology. No use of such things. When we go back, we cannot answer to the God. What did you do? That, I made something for a elite group of people, 0.1%. That doesn't change the society. Make a world-class technology which reaches everybody in the world, to all the surgeons, all the patients, second tier, third tier, not to compromise the quality. It is not that, you have a best suit and you don't want a suit after 100, you want to give to somebody. No. You give the best of you to the least in the strata, base of the pyramid. That is what is actually achieved with SSI. Second most important, why do we have version 3? All of us learned a lesson, in COVID, which dinosaurs didn't learn, so they died. Who are the biggest magnets in the world? Dinosaur. Are they alive today? No. So it is not somebody which is an MNC company with $1 billion you have and muscle power, money power. No. A race which can adapt, survived. So who has survived here today because of COVID? We adapted. We learned new normal. Dinosaurs didn't avoid, they died. So any technology which doesn't evolve with the time, with the understanding of the needs, will perish. That is why you have version after version. If you look the landscape of robotic surgery in the world, it takes minimum 7 years to bring a next version, even if you do a cosmetic change. Here we have a version 3, which is truly version 3, not that you put one button or you change a screen and say, oh, new phone, and then charge another $100. No. Totally disruptive new technology. What it takes 5 to 7 years for the best of the best in the world who have a technology of space to do, is done in India in 5 months. That is the strength of the team, Dr. Srivastava, the engineers, and the people have. Why is it so required? Not many people know. You know what people think? Open surgery is cheap. No. For a healthcare, even if you go to a government hospital, trust hospital, corporate, private, you know what is the cheapest surgery in the healthcare? Minimal access. Don't have to give antibiotic. They go home in 2 days. They don't have to go to ICU. You don't have to give blood transfusion. There is no pain. So lost weekly wages of common people and their attendant tied up to hospital is lost. So least infection. But unfortunately, 99% surgery in the world, including India, is open. It doesn't matter who pays, government pays. It's all your and our taxpayer. How do we bring this minimal access to everybody and make it the most cheap for a healthcare and you save your hard-earned money by doing minimal access? That is not possible with laparoscopy. That is why this machine SSI is made where the minimal access can reach majority of the people, change the landscape, use your precious money for something else, use your hard-earned time and months, go back to your society, live with your family and the work. This is what this particular thing is actually achieved. And I'm so honored to be part of this journey, even a small, minuscule contribution. They say that you have a small contribution even to Rama to walk on a small, even if you are 1 stone, it's good. So, you are proud that you are a part of it. And this is just a beginning, and this is going to change, not to you, me, nation, company, but to the people for which it is made. And we are very happy we are able to see in our lifetime such a disruptive technology which can change a revolution and not just an evolution which Darwin told. Thank you very much and congratulations.
Thank you so much, Dr. Somashekar. You always charge up the audience with your power-packed narratives. Thank you so much. We are now joined by Dr. Naresh Trehan, Chairman and Managing Director of Medanta, the Medicity. Dr. Trehan left United States and came to India in the early 1980s and was the first one to establish a heart institute in Delhi. He has received numerous awards, including the Padma Shri and the Padma Bhushan. Dr. Trehan always believed that patients should receive the best, and keeping that commitment, has created a series of Medanta hospitals in the country. A close of Dr. Srivastava, Dr. Trehan could not join us in person due to his busy schedules at the hospital, but we are delighted to have him participate in this event virtually. Dr. Trehan, we welcome you, and it's such an honor to have you with us.
Thank you very much. And good afternoon to everybody out there. Sorry I couldn't make it physically, but the operating schedule is still packed, so I'll try to do my best virtually. But I was listening to Dr. Somashekar, and he's done a very, very extensive and hard-hitting sales pitch for the mantra. So there's very little I can add, except the fact that I take this opportunity to compliment Dr. Srivastava, who I've known for the last 35 years, and who has actually been at it and created this Indian Mantra 3 now, which is really a technologically a great achievement and very rapidly achieved. This is, I must say, something everybody must feel very good about, because it's an Indian machine. It actually makes it possible for many, many more people to afford robotic surgery. And all the virtues of robotic surgery already Dr. Somashekar has very forcefully said already. So I will not repeat that, but I can only say that yes, we have tested Mantra 3 and even Mantra 2. We have one Mantra 2 with us already, and we're looking forward to the Mantra 3. And we will incorporate it into our hospitals as it becomes available. So good luck, Dr. Srivastava, and thanks to all of you for giving me this opportunity to share my views with you. Thank you very much.
Thank you so much, Dr. Trehan, for joining us online. It's my pleasure now to request Mr. Girdhar Gyani, Director General, Association of Healthcare Providers, India. AHPI represents vast majority of healthcare providers in the country and is a not-for-profit organization which works with all the stakeholders to ensure the delivery of appropriate services to the community at large. Welcome, sir.
Thank you.
Yeah, of course, I am representing, you can say, more than 25,000 hospitals here. And talking about robot, I think when two of the best surgeons have spoken about it, I don't think I can add anything more. In fact, I don't know how many months back I visited your plant. And I have experience of working in the high technology, including space and aeronautics. And when I saw this plant, it was amazing. I never expected that in India we have that kind of work culture, not only technology, the work culture which I saw among the people and staff there, it was mind-boggling. And that is where actually, in fact, I wrote to Dr. Srivastava that we are bringing a big compendium of healthcare leaders, and they explain their journey, how they have brought this enterprise. I don't know whether you have received that or not, but there is still time, and I would like to include his chapter because I tell you, it is not easy. Enterprising, you know, some people may have maybe excellent surgeons, maybe excellent engineers, but to have courage to venture into this area, which so far we always depended on the import. And this gentleman has really come out, and the technology which has brought, and now this version 3. So I'm really very proud to be here as an Indian, that Dr. Srivastava is going to make us proud world over. And briefly, I can tell you that just before the election, you know, we had almost long 7 hours kind of discussion with the top officials of the government. And what actually came out was that they presented the statistics that we have around 1.5 beds per 1,000 population, and we have to reach 3 beds per 1,000 population in next 5 years. And for that, they need the help of the private sector. And the immediate target was 300,000 beds for the tier 3 towns. That is very challenging. 300,000 beds we need to build in tier 3 towns, that is to of the tertiary care, not primary or secondary. Now, this is going to be the roadmap which actually will come out in few days, 100 days roadmap, you know. So this is where actually this kind of technology, why we should be talking about this technology only in Mumbai, Delhi. I think why can't it go to, you know, at least tier 2 towns? And from tier 2, we can connect with tier 3 towns. So I think we have, I think, huge opportunity in this country, let me tell you, because healthcare now is on the agenda of the government. 2017 new health policy, 2018 Ayushman Bharat, largest insurance scheme, 2020 National Digital Health Mission. So you can really see, but we have few limitations, and I keep saying that our Prime Minister actually, when he launched Ayushman Bharat, I was there in the Vigyan Bhavan, and you know, I really knew that we are launching something for which we are not prepared. But sometimes that works. You first launch, automatically things will fall in place. I think that is the kind of approach we are having. So once again, on behalf of huge network of the hospitals, I really want to congratulate the team of Dr. Srivastava, and I'm sure we will work together to reach this robot in tier 2 towns as well. Thank you very much.
Thank you so much, sir. With this last speech, we conclude our program, and at this point, I would like to open the forum for question and answers. Kindly identify yourself if you want to ask a question from any of our delegates here today. Can we please pass the mic there? We are passing the mic to you, sir. We know you, sir.
After glowing terms about mantra by Baby Sethi, the Moon Man, Soma Sekha, I should, though I am a lay media, I should, as an Indian, be proud of mantra. I should look at mantra as the greatest trophy of Make in India. But there is a big but. But you are pitted against juggernaut called Intuitive Da Vinci. I have observed that Da Vinci is preempting mantra at every way of this step. So how are you going to break the monopoly of that juggernaut? And how are you, where you stand quality-wise against Da Vinci?
I think this is a question Dr. Soma Shekhar should answer. He is most equipped.
You know, there is a saying, truth and technology and the best thing cannot be hidden. It doesn't matter, you know, how people reach. Somebody took a lift and went up. Somebody is coming through a stairs. The quality, the truthfulness, and affordability, honesty, and the work will speak for itself. I will give one example. What it took 30 years for laparoscopy to achieve, robotic achieved in 10 years. What it took 32 years for other company, it took just 2 years for SSI to achieve. So we would never, anybody would view anything as a competitor. You keep doing your good work and you will reach the finishing line fast, soon, if you are truthful, which is the best technology and is done with a good intent. That shows that what it took 20 years for other platform in India to sell, in less than 1.5 years, this surpassed that. Because the end user will not get into any of the politics, will just look, is patient and what is right, and that is what is proved, and we would reach there. Just keep doing your work, your goal, and we will reach there like what Swami Vivekananda told.
Sir, I wanted to know, do you match Da Vinci quality-wise? Don't be philosophical.
Absolutely. I would put
Answer it in categorical terms.
Absolutely. I personally myself have done 100 most complex cancer surgery in this platform without any change in the outcome. The same outcome which I gave in last 6,000 with other platform to my patient has been given in this. I always treat every patient as if it is my father, my mother, my sister, brother, and I'll not give anything less than the best to them. And I have done the last 100 most complex surgery on this. Not only me, many other surgeons, over 300, have done 1,400 surgery across various in last 1 to 2 years when we audited. The quality is not only matched, it surpassed in very different form. So there is no compromise that if it is any of our family member, this is the robot we will definitely use.
Dhananjay, I'm going to add, not as an SSI chairman or CEO, as a robotic surgeon, because I have been around using the previous system. And all I can say, without reservation, and even to quote Dr. Fred Moll from the previous time when he was here, that SSI has more advanced and better features that other company could not do. And the reason is simple. Any change that they make, they have to go back to FDA. That is 2, 4, 5-year process. You take the last generation that just came out, Da Vinci 5, it took them 12 years to bring out the system. And I'm not being critical. Firstly, I always make a point. I'm very grateful to Dr. Fred Moll to have initiated a pathway that gave us opportunity to do things differently and help the patients in much less invasive way. But unfortunately, sometimes monopolies are not good. And they basically become very focused, and somewhere the financial incentives kick in. So instead of remaining a science company, there is a tendency to really become a massive financial company of success. Now, what we have done at SSI is always, with whatever clinical experience I had, there was a very simple goal: not to copy, make it better, make it affordable, make it more user-friendly, give more enabling technologies and features that no one has. And today, sitting here, having known the circle and very familiar with what else is going on in the world, I can tell you with absolutely no reservation that we today have the best system with best capabilities, most specialties, including heart surgery, and the affordability factor, the guidance through teleproctoring, ability for telesurgery, and bunch of disruptive features that today no one has, including Da Vinci. All right? As a surgeon, I'm speaking not as a competitor. Yes.
Sir, there would be many to ask questions. Can I ask one more question?
Yes, if
Last
you can.
but not the least.
Sir, but the crisp one, please.
Yeah, Chris. It is
Yeah.
Chris. Sir, you talked about, I shuddered to hear you talking about there was no mortality, no injury, because it implied that there can be injuries. So there is a question of training. There are not very many robotic surgeons like you, like Soma Sekhar in India. So speak about the need of training in India.
I think I'll pass it on to Dr. Vishwa. He's been quite involved with our training programs and does train surgeons and help them, So we have a very step-by-step platform going not only from that to teleproctoring and finally now to telesurgery. So Vishwa, if you don't mind.
Yes, sir. Yes. This is Dr. R.K. Devan.
I'm Dr. Ravindra Diwan. I'm a thoracic surgeon, chest surgeon, and we are the first government institution to take SSI. And I have primarily taken it because it has less cost. Simply speaking, because I did not want to invest so many of Government of India's resources into robot for a single specialty hospital. As all of us know, that robotic surgery finds its greatest use in urology and general surgery and laparoscopic surgery. So, to answer his question that about the training, we had training for the company, all members of the team, for 2 months, and unless we completed that training, we were not allowed to work on that. And then we worked on the patients, and all our initial cases, 8 to 10 cases, their team comes, it stays in the operation theater, and they also provide a mentor, so the thing is safe. And then later on, we are slowly coming out of it. Unfortunately, in my own institution, because of some reasons, our theater is getting renovated. We have not started using it in a big way, but we have done 8 to 10 cases already, so that part is clear. But as a question, because I have to ask a question, sir, being a thoracic surgeon, I am very much interested to know when are the compatible vascular staplers coming, because that is an area in which Da Vinci takes a lead over you. Thank you.
They are around the corner. In fact, design has been done, parts are being manufactured as we speak, and unfortunately, any technology development, I've learned one thing, don't give a date because a lot of things are not in our control. Although we, make sure that it's a perfect design, it goes to manufacturing, comes back, and sometimes there are issues, because of the complexity and very fineness of, especially these, stapling devices. So we have to make sure that, it is absolutely perfect. So sometimes delays occur, not for our reasons, but once it comes to us, then also we have a very serious responsibility of making sure that it will be functional, that there will be no leaks. The staples are not going to fall apart or come out loose. So again, we must do all the diligent steps. So when it hits clinical, we are sure that it will be safe and it will do the job. So we are always at it, but equally, very serious responsibility to make it perfect.
And I will say one thing, I sit with the engineers, so to answer your question, Dr. Devan, with regards to the thoracic, and GI stapler. So, we have designed something very novel, which is very different than how all these other staplers are. As you know well in your practice, many of these staplers used for wedge resections and such, they're all single use. So we've figured out how to use replaceable cartridges with knife inside. So it's like having a new cartridge every time. You can use the same instrument more than 100 times. So keeping in line with our mantra of making things accessible, affordable, and available to all, because ultimately, see, the ultimate beneficiary will be the patient. And so, to answer the previous question on the training, I think I'll take maybe half of the question, then I'll give Dr. Somashekar an opportunity, you know, being one of the most renowned trainers and robotic surgeons in the country, having trained so many people. But see, our philosophy is simple. We have a very rigorous training program, you know, 1 week of didactic training modules. We separate all the hospital staff into 3 teams: surgeons, nurses, and then OT support staff and technicians. Everybody goes through their responsibilities. Ultimately, surgeon has to know the responsibilities of all because they're the captain at the helm. And then everything will ultimately fall on them. But then we do hands-on approach. You see, many other robotic companies or medical device companies, you know, they sell you the product and then, you know, they have a couple days of training and then they wish you the best of luck. See, because we're a company that started with doctors, run by doctors, all of our end users and inspiration are also doctors, we have a different, very different approach in philosophy, and it's very similar to how the training that doctors undergo during their medical college years and training. It's that until and unless, you know, the program that you launch succeeds, we as doctors, we as people, you know, behind the steering wheel at SS Innovations, until they succeed, we feel that we have not succeeded. So we really put all of our best efforts into training because ultimately the goal, you know, is not to have our people, you know, sitting in the operating rooms in 100 programs. We cannot have 100 people, but to train them to the best ability that we can so that the program will then be self-sustainable. And we have a saying in medicine, see one, do one, teach one. So we want to train them so well that when new surgeons come into their hospitals and organizations, they know everything so well that they're able to teach from within their own organization and carry the torch forward. And Dr. Somashekar, maybe you can offer some light.
You put it extremely well. What is most important is everybody acknowledges training is the most important part. It is so structured, you know. I always tell that, you know, those of you who have seen Spanish dance, flamenco dance, it doesn't take one expert to do. Remember, here we are not teaching how to do the surgery. That's a part of your training. I'm not going to make a urologist, thoracic surgeon, and I'm not going to make a cancer surgeon, a cardiac surgeon. You have learned that. What is, you know, there is a term called two for tango. If you want to do a flamenco dance, the two people have to imbibe and marry to each other. So a surgeon has to put himself in this machine, learn how to do the surgery which you have learned by your training, which is recognized by the law of land, using this machine so that you combine, and then, you know, Ardha Narishwara, they say two people. So finally, a renowned robotic surgeon, what happens is you can't separate your body from the robot. So you learn to understand this machine. So this is understood very well in the mentoring, proctoring, and training, and that is very well structured in SSI. The proof is 99% of the people who have been trained, 300 on SSI, are able to quickly, in 2 to 3 weeks, able to perform a surgery to their satisfaction, what they've been doing in any other platform or open, and continue to give high quality with lowest mortality, lowest morbidity, which is acceptable to your peers. So that's a proof of it.
And I think I will just add one thing, and I know we talked about that in my presentation. And Nitin, I see you. You better come here now, latecomer. So apart from all the things that have been talked by both Dr. Vishwa and Dr. Somashekar, the teleproctoring, it is very, very important because, again, as has been pointed out, more and more centers when they open up, we cannot have enough surgeons because they also have to work in their facilities, flying here and there. Unpredictability of the skill level of the surgeon, whether patient decided to go to another hospital last night, you know. So these things actually happen and don't know how long to block the time because we have no idea what surgeon, how long they take. So we have really gone very fast on teleproctoring. And I tell you, I don't know if a lot of you are younger, but there was a movie, Tom Cruise's Minority Report, where all these virtual screens are there. We have it today at SSI. Our Maya division has done absolutely wonders. You know, you have this 3D view in your glasses. You have all these screens where you can literally, what is called the telestrate or draw for the surgeon. So literally it's a two-way communication and having a camera in the room. So what does a proctor do in an operating room? They basically will see the operating room setup, tell the nurses that put this, tray of instruments here, position the cards here, and certain instruments that are needed. So all that can be done literally long distance today. Having a camera that will capture, and our team has done that each operating room can be created in virtual 3D space, whereby in relation to what procedure they will do, all the guidance is built in already. Positioning of cards, where do you put this thing, and then guiding the surgeon, watching the same 3D view that the surgeon has, and I have done it already twice. So teleproctoring is like having an attending surgeon in the room guiding the fellow. And when telesurgery is when the surgeon or the trainee cannot do it, you take over and finish the job. So I think essentially it is a complete holistic approach beyond the routine training that occurs regardless. And beyond that also, we are collecting the data from every center. Every procedure is reported back to us. So we can find out why there are some issues. And it will help us solve those early on. We are even talking about putting a camera watching surgeon's hand as we are recording all the cases. So to see where they are having difficulty, or even watching their vital signs, when they start to sweat, and when their blood pressure is going up or heart rate is kicking up. So basically the whole idea is to find what is causing the difficulty, because this is how we need to solve, not by just pointing out you didn't do this thing right, but how can we fix it? So that really is the approach, and this is where technology becomes so helpful in reaching the ultimate goal and launching new programs. Also some difficult case that Dr. Somashekar does routinely, other surgeon is having a struggle. And he calls, and for the sake of the patient, so patient does not have to leave and go to Bangalore. He can sit there and operate on that patient in that operating room, wherever. So this is really how we are approaching, advancing the medicine, making it most beneficial to this ultimate beneficiary, our patients. So I'll stop here.
Can we have our next question?
I'm going to give you have 1 minute to talk about...
Before we start, I think I'll have to mention this, that Doctor, congratulations on doing the largest number of cardiac surgeries through SSI Mantra. And it is a feat which is not accomplished by many, and it'll be great to hear your experience of using this made-in-India technology.
Thank you so much. I'm a cardiac surgeon. I was working in Narayana Hospital, Bangalore, till now. And now I'm going to shift to Medanta Hospital, Gurgaon, very soon. Collectively, in Narayana, we have done more than 100 cases now. And out of those 100 cases, I have performed 49 cases. We 4 or 5 surgeons are collectively getting trained with the SSI Mantra system. We started our first case in September last year. So maybe 8 months, we have done so many cases. The advantage of SSI Mantra is that it has an open console. And nowadays, every surgeon is basically trained in laparoscopic surgeries with the same idea that the screen is in front of you and you need not to look downward and do the surgeries. So those surgeons who have basic idea or training in laparoscopic surgery can pick up very fast. So we started with the conduit harvestation that is required for bypass surgery to give blood supply to the heart when heart blockages are there. We started with the single conduit harvestation that is called internal mammary artery. That's the basic surgery which every surgeon wants to start with the robotic system. And thereafter, we started harvesting bilateral internal mammary artery, which is actually very cumbersome and difficult with a small thoracotomy incision in minimally invasive heart surgery, or it's called keyhole heart surgery, in which there is no big incision given in front of the chest. The conventional way of doing it to give 10 to 12 inches incision, but if we use robot for bilateral IMA harvestation, the incision can be reduced to 2 to 3 inches rather than using a conventional way and giving a 12 or 10 inches incision. And the next level of expertise, or you can say advancement with the robotic system, which is only available in the Mantra system, is total endoscopic robotic bypass surgery. In this method, there is no need to give any incision. Only 4 ports are needed. Means you give, like laparoscopic surgery, only ports are needed. The same way, we can do total bypass surgery with the help of robot. And in this world, at present, only SSI Mantra gives this technology. Next expert advice to the fraternity is, most of the adult intracardiac procedures, most commonly done surgeries like valve replacements, valve repairs, closure of hole in the heart, in the simple anatomical structures, all can be done now robotically without giving a big incision. Patient can recover within 1 to 2 weeks and go back to the work. There is no need to, take advice for rest at home for 3 months, or no restriction for any activity. So this new robot, Mantra 3, is far, far advanced than the other systems or the previous system itself. It's very sleek, the range of movements are better, freedom is better. Freedom is better means your wrist movements, that is called endo-wrist movements, can be better. We cannot move our wrist to the range which this robot can actually do. So the all hidden areas I have actually never saw during my minimally invasive surgery, now we can access this very nicely with the robotic camera system, which can actually articulate in any direction. So I would like to thank Dr. Sudhir Srivastava sir to give us such a nice machine for all, and congratulate all the fraternity and all the surgeons, including cardiac surgeons in all the branches, that we are now blessed with such a nice robotic system in India. Thank you so much, sir.
Thank you so much, Dr. Rajput. Can we have a couple of more questions, please? Can we please pass the mic there? Oh, you have it.
Yeah. Good afternoon, sir. This is Nagesh Doshi from Healthcare Radius magazine. We'll be talking about affordability. Can you give us rupee cost comparison between Intuitive's latest platform and SSI Mantra 3 on CapEx, the acquisition part, as well as the consumables, the OpEx, and the impact to the patient? What will it cost to a patient on the international platform and SSI Mantra 3?
At the risk of my sales and marketing team, hijacking me as soon as I walk out of this room, why did I say that? I can give you a general, also please understand, we are at SSII, are a public company, and I have been advised not to get into financial discussions in open forums, mainly because of our listing status, which can be looked at differently. And please understand, SEC can be pretty strict about somebody using the information and giving an impression that I shared certain so-called inside information. So if it is okay, a lot of this is available in various domains, including on our SEC website. And I encourage you to look into that. Sorry, I cannot answer that question.
Thank you. Can we have the next question, please?
Good morning, everyone. I am Dr. Chandramohan, urologist from Hyderabad. I first of all congratulate Dr. Sudhir Srivastava sir, Dr. Vishwa, and all the team, especially the junior engineers. I have interacted with them before I brought this mission. Few points I wanted to mention, that the learning curve with this mission is less. I could learn in 1 or 2 days, and I'm happy to say that in a small baby, 1 year baby, we could perform well. That is on behalf of me, that pyeloplasty we could do in 1 year baby with this mission. And I have done personally within 1 month, I have been given a live transmission from our Preeti Hospital to Ahmedabad in our National Uro-Oncology Conference, which I could demonstrate successfully. And that patient, 3 days back, we removed catheter, 0 incontinence, voiding very well. For all urology pedantry, I have sent the voiding film because they were focusing on other small things than technique. So technically, advanced surgeries, as sir mentioned, can be done with this. I have done up till now 40 surgeries in 3 months. No case I have converted. At least I am telling that for some of the juniors came from different parts of the country to listen what. I have not converted to laparoscopy. I have not produced any significant injury to the patient. And I am adapting to the instrument very well. And the company is also in terms with me whenever I say a small video not captured. Vishwa has taken pain to get back that video. That's my first radical prostatectomy. One of the best surgery I have done. I'm happy, and my YouTube also have produced. So company is also cooperative. Every day is an improvement, as sir said. Definitely we look forward, and it's going to make some difference in the Indian history. Thank you.
It's motivating to hear from you, sir. Can we have the next question? I think we have, yes. Can you please introduce yourself?
I'm Dr. Deepak Puri. I am a Senior Director of Cardiac, Vascular and Thoracic Surgery in Max Hospital, Mohali. So I am very happy to be here today, and it was a pleasure meeting Dr. Sudhir, because I have been hearing and reading about him and seeing his videos also. But today, for the first time, I came here. And I'm going to meet him, and I'll be here with him for a day. So, Dr. Sudhir and Dr. Nitin, I congratulate you that you have done a really something which we have been imagining, because when I was in PGI as an assistant professor, that time robotic surgery came to the world. And we really used to imagine that in the next 10 or 15 years, we will do cardiac surgery by robotics. So I even went, I shifted to Fortis, and from Fortis, I even went to Dr. Jonas Bonatti. He was, that time he was president of robotic surgery. And he used to do TCABs every day, 2 TCABs he used to do, total endoscopic coronary artery bypass. And we really wanted to bring robotic surgery to India, but when I came back, we talked with the Fortis management, and they arranged a meeting with the Da Vinci people, and they told us that we'll bring the robot and then we'll give you a training, a short training. And which I thought was totally inappropriate, because if you have to do cardiac surgery, it is different from urology surgery and gastrointestinal surgery. So you need to be very meticulous, because when we are doing anastomosis on a coronary artery, which is in Indians hardly 1.5 millimeter or many times 1.25 or even 1 millimeter. So to get the precision, we need to have a meticulous training program. And moreover, like if a surgeon wants to be trained for robotic, but if the organization for which the surgeon is working, if they are not in favor of launching robotics for cardiac, then is there any way that we can like get trained and then maybe we can become proctors and start doing the surgery in multiple hospitals? Because we have Da Vinci robot in Max also, but they are saying it is not compatible for cardiac or thoracic. So I do a lot of video assisted thoracic surgeries also, and I do by the uniportal technique. And I find it very like the patient goes home in 48 hours. So I find that if we get the opportunity to get trained properly and we can do the surgery, because previously in between I started freelancing also, and that time I was operating in 12 hospitals. So I made a team, and then we were working as a team and used to operate in the morning in a different hospital, in the afternoon in a different hospital. So if we can replicate the same and do the robotic surgeries in a similar way, I think we can reach to multiple remote areas also. And but the thing is that if the big companies like Fortis and Max, they are not willing to create such a team, then is there any way out that we can still make that happen?
That's the question, huh?
Yes.
Because I was listening to your life history. We'll talk later when we meet about the rest. Definitely, in fact, I'm very passionate about reviving the cardiac field. I think it is a much needed change in the approach, because many other specialties have laparoscopic or endoscopic options. Cardiac surgery, most leave in 98% today, if you look at the global scene. Patients are having sternum split, long recoveries, complications, blood transfusions, on and on. So we have demonstrated, many other surgeons also have demonstrated, cardiac surgery is possible to complete ports only. And yes, there is a learning curve. I always say, especially cardiac surgery, like most other robotic surgeries as well, you must want to do. And that means you have got to make a commitment. You got to spend time, learn correctly, spend time practicing, because cardiac surgery being a high risk where we can kill a patient on the table, must take it very, very seriously. To develop the skill level that is required when you don't have the tactile feedback. And there's a very specific training program, and maybe we can discuss that. And one of my goals is, while I'm in India, is to really create a training institute again. We did that while I was in US. Trained over 350 various surgical teams from around the world, launched programs. I have traveled and launched quite a few programs in the country today. And Nitin is one of our success stories. I showed him one case I did myself. Second case I did half. And since then, he threw me out of the room. Okay? And so basically, it is possible, but people must make the commitment and do it. And we will do that. I'll help you personally, help launch the program. No issue at all. And we'll talk more about this thing. I know there's a gentleman who has been raising hand there. Yeah, so
Yes,
please.
can we pass on the mic, please?
Hi, my name is Rajiv Chaudhary. I am representing Drug Today Medical Times. I have two small questions. First one is that to what extent disruptive technologies are going to be the order of the day in the coming future? And related to that, how artificial intelligence is changing the landscape of medical services, especially in the field of surgery?
I think disruptive technologies definitely are going to help more and more patients. See, ultimately it comes down to if surgeon finds the use of technology difficult, they will not become good at it, and at some point they will give it up. And this is part of the reason that when you look around, not every hospital has a robot, not every surgeon is doing or is able to do, and especially when you get onto the cardiac side, literally there are a handful of surgeons who are continuing to do, mainly because technology help has not been provided by the companies. So one of the goals for us was to, how do we change whereby it becomes easy for the surgeon, so he feels encouraged. Yes, there is a learning curve. One must go through that. Nothing can be done. Surgery is like a sport. By watching, you don't learn. By doing it, you advance. So more and more surgery that people do, and also if it is easier to use, then the timings all will come down. And then suddenly it becomes a joy to use the system. Secondly, on the artificial intelligence side, and I know it's a buzzword these days, and whether sometimes it really has a value, and I think we must be very careful also when we talk of AI. I mean, everybody is talking about the AI. It's like a knife. It can be used for good reason and also for a bad reason. Now, I'm sure you guys have heard all kinds of voices are being imitated, and on behalf of other, various statements are being made. Now, there's a horrible example of use of AI. You have no idea is President Biden speaking or Dr. Rehan is speaking, okay? And so artificial intelligence is good. The thing is, ultimately, I'm not so sure what is artificial about it, because it's a human that is programming the system and teaching it how to make decisions through algorithms. Now, when you talk of surgery, we are actually looking at it very seriously in relation to incorporating AI by semi-automating certain surgical steps of the procedures or operating on that patient anatomy ahead of actual surgery. So we can make mistakes on the computer and not on the patient. So we are looking at it very differently, and I think AI will have a huge role in this evolution. Not only that, also in terms of what I call diagnosis and teletherapies. You take breast cancer as an example, one of the biggest killers for ladies because of cultural reasons or access reasons. There are late diagnoses. Now we can put an ultrasound probe onto a robotic arm. Sitting here, we can control. Literally, it can be put on a smear, and the AI will diagnose the problem. So there are ways that AI will be used, or through AI and machine learning, ultrasound can be done wherever. Biopsies can be done wherever. And certain therapies can be done wherever. So yes, there is a huge role of AI and machine learning in medicine. It will take time, but it is moving very rapidly. But also, a word of caution, we must be very careful that we don't give up the human controls of any other intelligence.
Do we have more questions? Perfect. So I think we'll now break for lunch, and I would really like to thank all of you for being so patient and being so attentive. So last few closing words from your side, Dr. Srivastava.
Thank you, Shruti. I have told her, as long as we are in SSI, she will always be master of ceremony. She does a phenomenal job. So Shruti, thank you. And her team that have organized this event so well. Congratulations, and we're proud of you guys.
Thank you, sir. Thank you so much.
Secondly, to our SSI team that has absolutely worked day and night, holidays, weekends, not only to create this system, but to really organize a lot of these things in a very efficient and ultimately very effective way. And of course, thanks to my colleagues here who, and we can produce things. If there are no users, it doesn't matter. So really their commitment also to take chances on Indian technology. And it's not always easy, something that you're used to make a change. And it takes courage also. And also very proud that I think we are gradually seeing the pride of things in India. And I think Dr. Somashekar has very eloquently pointed out our very proud history in every possible way. And I think this is really as what is called also the Swarnkal. And we will reach there. So I think one of my pleas is to not the people who are here, but through the government also, let's really do it and let our scientists, our surgeons, our engineers really get involved in innovation. We have brilliant minds in the country, as has been seen in so many fields. But sometimes, unfortunately, because of the resources, we are not able to bring it, and we keep bringing things from outside. It's high time that we really all get involved and really, make India proud again. We have a wonderful history. We suffered a lot. It's high time that we come out of it, and it is possible. We have seen it. I have seen it with our team in India, what has been created. So once again, and wonderful media, I want to thank you for your interest in what we are doing. Ultimately, the awareness is very crucial in bringing some of the messages that what we are trying to do that will benefit not only the people in India, I think of course that is our first priority and first platform and goal, but also for the rest of the world at the humanitarian level. And so a lot of our vision is that. So I really thank you for being here, and I know a lot of these things run late, and so appreciate your interest, and please help spread the message. That's most important, and spread it objectively. We don't want you to sell us. Our system will sell itself, as Dr. Som has said. But please bring the awareness to people. Very important that something is happening in the country that will benefit so many, many more people. And our goal is always, as we mentioned, go beyond the central large cities. And we already have systems in smaller cities. Dr. Magan Mehrotra in Moradabad, in less than 8 months, he has done over 240 cases. In one day, he did 8 cases. So our goal is really we are achieving, and sometimes, changes take time. It does take time, but we are all determined. So really, all I can tell you, at SSI, we are absolutely committed to make India proud and to help humanity at every level. And I think with a collective effort, we will succeed. So thank you again at every level for being here. Yes.
Thank you so much, sir. I would now request all of you to please join us for the lunch. Can we have all of you for a group photograph, please?